Back in. This month is a Gynecological Cancer Awareness Month, and this afternoon we're on your side with what women need to know about the most common forms of GYN cancer. Dr. Katisha Vance is with Princeton Baptist Medical Center in Hematology and Oncology, and she joins us now via FaceTime with more on how to check for symptoms and tips for reducing risk for cancer as well. How you doing this afternoon, Dr. Vance?
Hey, good afternoon, Sheldon. I'm doing great. How are you?
I am doing fine, thank you. So what is the most common GYN cancer?
So, Sheldon, the most common GYN cancer is actually uterine cancer. And so in the United States, there will probably be about 65,000 women diagnosed with uterine cancer this year. And then the second most common is actually ovarian cancer, with about 13,000 cases for 2020.
What are the risk factors that when we talk about ovarian cancer that are out there?
Yeah, so unfortunately, the most common risk factors for ovarian cancers are the ones that we can't actually do anything about. It's really about heredity. So if a woman has a first-degree family member who's been diagnosed with ovarian cancer, we know that that increases her risk. Women who are of Eastern European or Ashkenazi Jewish ancestry will have an increased risk of ovarian cancer. There are, however, some modifiable risk factors. So, for example, we know that for women who have children and for women who breastfeed, it can actually lower your risk of developing ovarian cancer.
Interesting. And how do you screen for ovarian cancer?
Well, Sheldon, that's actually one of the tough issues with ovarian cancer. We don't really have simple or reliable ways to screen for ovarian cancer. So it's not like breast cancer, it's not like cervical cancer where we have very reliable ways to screen. The most important thing is for women to know their bodies. And if something is different, you need to make sure that you talk to your physician about it. We do have blood tests that we can do. There's a CA-125 level that can be checked. It is not the best way to screen for ovarian cancer. And we also have transvaginal ultrasound. So all of these are tools that we have, but they are not a standard of care, if you will.
Yeah. You've covered a lot of information so far, but how common is the ovarian cancer?
So fortunately, it is not a terribly common cancer. We see about 20,000 cases a year, and a woman's lifetime risk is only about 1% for developing ovarian cancer. The problem, however, is that ovarian cancer, though it's not very common, is actually one of the top 10 causes of cancer death for women.
Wow. We certainly do appreciate you, Dr. Katisha Vance, for joining us this afternoon over at Princeton Baptist Medical Center. We hope to be talking to you in the future as well, but thank you for helping us out with such an important subject that we had today.
All right. Thank you, Sheldon.
Okay.